If you've clicked on this video, you probably started to notice the signs of aging and you're trying to decide whether to have fillers or have a facelift. So what happens in your 40s? Well, I call it the 3 Ds of aging. You start to see degradation, descent, and deflation. You have degradation of your collagen in your skin. You start to lose elastin, collagen, and hyaluronic acids. So you start to see fine lines and wrinkles. You have descent of your facial tissues. You start to see a little bit of heaviness in the lower face, and you get deflation of the deep fat pads and the structure that used to give your face all that support and beautiful padding. So what's the solution? Fillers, a facelift, or something else entirely? Well, I'm going to share this with you scientifically and honestly and gently so you know exactly what your options are. So let's get into fillers. What are fillers? Fillers are, generally speaking, made out of hyaluronic acid. That's a sugar molecule that is a biodegradable, biocompatible gel-like implant that is injected into your tissues to replace lost volume. It's a fantastic solution for those who might have mild to moderate signs of aging. You might start to notice that you're hollowing over here, or you've got nasolabial folds or nose to mouth lines. You just want to give your skin a little bit of a plump and restore the lost volume, but not necessarily change your face. That's where hyaluronic acid fillers really come in, and that's where they are really best suited for volume replacement alone. Now, fillers over the last 2 years particularly have been demonized. There was an MRI that went viral that was actually used, I think, to scaremonger a lot of people. And I've made a whole video on this particular MRI because that patient is a patient that came to see me and we commissioned the MRI and volumetric analysis. So make sure you click on that video. But here's the reality. Fillers are a fantastic tool that have been around for decades, and unfortunately, they've recently been demonized by those who want you to have an alternative treatment, namely surgeons who are encouraging early surgical facelifts. So what's really going on here? Well, actually, the tool is not the demon, it's the person behind the tool. And especially in the wild, wild west of the UK, anybody can buy filler off eBay and inject it into your face. If you keep having filler at recurrent times consistently, even when you don't need it, guess what's going to happen? You're going to start to look distorted. You're going to start to look puffy. Things are not going to look normal and your face won't animate as it once did. And that's called filler fatigue. We've all seen bad filler. But actually, the vast majority of people who've had filler look natural. Good filler work is undetectable. And actually, if this is done strategically, it's a fantastic solution for those who want to subtly restore their facial aesthetics with minimal downtime and minimal cost. But like all artwork, the art is only as good as the artist, so make sure you choose your injector wisely. But here's a reality about fillers. Fillers cannot lift the face. They are used to strategically volumize areas of volume loss. So if you have significant sagging, then actually a surgical facelift might be the right solution for you. A surgical facelift repositions the tissues, so you actually get a lift to the tissues. And this is particularly useful for patients who have significant laxity in the lower face or also in the neck. And of course, aging happens in all layers of the face and also from top to toe. So if you're starting to notice significant laxity of your eyebrow or excess skin in the upper eyelid, then a surgical blepharoplasty to remove the excess skin of the upper eyelid may be a better solution if you want something long-term and a significant transformational change. So which one might be best for you? Well, if you're looking for something that is relatively low cost, minimally invasive with immediate results, a hyaluronic acid filler might be best for you. If you're looking for transformational change that lasts a lot longer, then surgery might be best for you. The thing with surgery is that it is invasive and this does require you being put to sleep. That's called a general anesthetic, which has its own risks. And of course, the surgeon will take knife to face, and that means that you will have scarring in the area. So a surgical facelift might last a lot longer. You might get 10 years out of it, but of course, the day after your surgical facelift, you are aging. No amount of fillers and no knife to face will stop the aging process. With fillers, you do need maintenance, where you might go in to see your practitioner every couple of years to see if a top-up is needed, and of course, only have filler re-injected if that's indicated. And that means if you start to see the signs of aging again. With a surgical facelift, because it's knife to face, you will have a surgical scar and what we call fibrosis, which is tightening of the tissues. So it's not something that you can have repeated every few years. And usually your surgeon will tell you to come and have another assessment in about a decade. Now, what that means is you might need to have another surgical facelift every 10 years or so. So consider that if you're starting in your 30s or 40s, where you will end up being if you have to keep repeating this in your 50s, 60s, and 70s. and that fibrosis and scarring can make future surgical facelifts more difficult and more complicated, with significant increased risks of complications. So which one looks more natural? Well, again, this is down to the injector or the surgeon. Fillers can look exceptionally natural if you have a good injector, and surgery can look exceptionally natural if you have a good surgeon. Equally, if you have a bad injector or a bad surgeon, you're very likely to look distorted. And what's the main thing to expect? Well, after filler, you might have a small amount of swelling, potentially a little bit of bruising before everything settles. And by 4 to 6 weeks, you're totally back to normal. There's no real downtime, which means you can go back to work usually the same day. Whereas with surgery, the recovery is significantly longer. Think 2 to 3 weeks of downtime where you're probably not at work, you have significant swelling, significant bruising, and you don't feel like yourself. And with surgery, risks include scarring, asymmetry, infection, distortion or lumps and bumps, particularly if you have fat transfer, and probably one of the most concerning side effects, nerve injury, where you end up with an asymmetry because the surgery has actually impacted the facial nerve. Of course, this risk is lower if you see someone who is highly experienced. So when would you choose fillers or a facelift? Well, fillers are an excellent option if you want something that's customizable, low cost, minimally invasive, and you want immediate results. And it's an excellent tool for early aging, mild or moderate laxity, and also for maintenance or prevention. But if you're in your early 50s, you have significant volume loss, deflation, laxity, and sagging, then you may wish to consider a surgical facelift for a more transformational change. I hope that's helped you decide. If you have any questions, please drop them below. Don't forget to like and subscribe, and I'll see you in the next video.